Today I want to share with you how I healed from chronic low back pain. What were the lows, what were the highs, what didn't work for me, and eventually what brought the transformation that helped me going back from someone who was literally bedridden to someone who was able to do sports, hiking, lifting weights, lifting suitcases, and basically doing whatever I wish and want. So in today's video, I will share with you my recovery story. I will share with you what didn't work in healing and what helped, what worked. I will also share with you the key insights and strategies that eventually helped me recover completely from the pain. And these insights and strategies come last, so make sure to stay until the end so you can also share that. If you're suffering from pain, if your clients are suffering from pain, I hope this helps you too. I want to share with you first how it started. I was 39 years old, and until then I used to suffer from maybe a week, maybe two every year of low back pain. But the pain came and then it was gone. So I managed to maintain a normal life, an active normal life. But then, just before my 39th birthday, I decided that maybe I need to do something about it, and I went to do a chiropractic treatment. I didn't have pain at the time, I just wanted to take care of myself better. After the second session, I left the chiropractor's office feeling that my lower back on the left side was beginning to ache. And then we lived in Berlin, Germany, and we went to the S-Bahn, it's basically the underground, the tube. And when I sat there, I felt that the pain is beginning to radiate down my left leg. And then my medical mind began to kind of recollect the data about back pain and herniated discs, and I told myself, okay, so this is probably a herniated disc, maybe a bulging disc, maybe herniation. Normally it should be resolved within 2 to 6 weeks. That's the natural occurrence of a bulging disc or a herniated disc. 90% and more are healed spontaneously. So I told myself, okay, so that's the situation, it's probably gonna go away. But then what happened is that time lapsed and the weeks progressed and my pain was still there. So after a while with this pain, I thought that maybe I should check it. Maybe I should do an MRI of the back. And I went to an orthopedic doctor, and he referred me to an MRI. At the same time, I started also doing physiotherapy. I think it was 20 sessions, maybe twice a week for a while, and nothing seemed to help. The MRI came back, but what was shown there is a herniated disc between L5-S1 vertebrae to the right, whilst my pain was radiating to the left. So there was a herniated disc on the MRI, but the pain that I experienced did not correlate with that. So even though I did this test, I still didn't have a solution or answer of the origin, what was the origin of my pain. So now all these attempts started creating fear in me. I started feeling that it's a hopeless situation, it's a helpless situation. I was already a few months into the pain, nothing seemed to help, and whatever I was trying to do, it just didn't help, it just didn't bring me to a better place. Then when fear started creeping in, I remember that was a huge intensification of the pain. Simple actions like going to the toilet or, taking a shower was as if I was trying to climb Mount Everest. These little things, these daily activities were so hard to complete with such intense pain. One time I remember it clearly, it was like hitting rock bottom. I remember going to sleep, and after not such a long while, waking up from sleep, sitting up in bed, feeling the most immense pain I've ever experienced in my entire life. This pain literally brought me to tears. I was so desperate. I was so afraid of it. I didn't know what to do. I didn't know what the solution was. And even though I tried so many things, nothing seemed to help. That was a point of desperation. Another point, another low I remember quite clearly is after a few months staying at home. It was already winter in Berlin, it was snowy, it was one of the hardest winters that was registered in the last 70 years until then. And I just wanted to breathe a little air. So I decided to get out of bed. That was my place back then. Get out of bed and simply go out to breathe some air. And I thought, what could happen, right? It's just like 15 stairs. I would go out, I would come back, and it would be okay. But then what happened was that I went out of the building, did a few steps, and the pain became so severe that I needed to stop and freeze. And then I needed to start calculating how I'm gonna go back home. It was only 15 stairs. But these 15 stairs took me 15 minutes. And I got home with such excruciating pain that I needed to rest the entire day afterwards. And of course, it took me 2 more weeks to being able to going out of bed. So next thing that came is that I somehow managed to maintain a routine. It was 50%. I wasn't really feeling well. When people asked me, I said that I feel like as if I'm double my age. I was almost 40 back then, and I felt as if I was 80 years old. It was as if I managed to somehow reach a sort of a steady state, but this steady state was like walking on thin ice. Everything that I did could break this thin layer of stability immediately. If I had lifted something that was heavier than I could, bent in the wrong way too quickly, or did an activity like carrying shopping bags, that could immediately take all my progress and all this, say, fake stability backwards and lead me back to the beginning point. That was the state back then. Here's, of course, a partial list of the things I tried to use in order to heal the pain. There was shots to the back with steroids, and I went swimming instead of walking or running because everybody recommends that. I tried ice packs, I tried a corset, I tried a TENS machine with electrodes that are supposed to reduce the pain. I tried creams, anti-inflammatories. I tried anti-inflammatory pills. I also tried supplements. Actually, this chair is also something I bought at the time in order to relieve the pain. At a certain point in time, after many months of enduring pain, we went on a holiday. It was after many months at home, being able to work half of the time, being able to function half of the time, being able to be half a husband, half a father. We decided to go on a vacation at the northern part of Germany, and one of the days we went to a water park. And my daughter, she was I think 10 years old back then, 10, maybe 11 years old, went on a slide. And I was maintaining this kind of fragile stability, as I told you before. And I said to myself in the impulse that came out of this moment, it was a very, like looking back, was not the wisest thing to do. And I said, well, let's go together with her on this slide. What could happen, right? And I went on this slide, not a very big one, not a very dramatic drop, but when I finished this round, I felt that my legs were completely shaking. I felt an intense pain in my lower back, and from then on it was like, you know this game of ladders and snakes and ladders. So I was going down the snake all the way back to the beginning point. And if that wasn't enough, we needed to drive back home. It was around 3 hours drive, not that bad, but with such immense pain, this is a challenge. And in the middle of the road, we had a flat tire. So me and my wife and my daughter in our car, and now I have to bend over and replace the punctured tire while experiencing excruciating pain. So you can imagine it was a very, very long drive back home. After coming back from this trip, I went right back to bed because there was nothing I could do. This sort of attack, this sort of immense pain meant 3 weeks in bed at least. So at this point I was really despaired. I felt at a dead end and I really didn't know what to do. Everything I tried collapsed, simply collapsed. All my strategy, all my ability to reach a sort of steady state simply shattered. And in this despair, I was literally lying in bed, not knowing what to do. My wife did an internet search, a Google search, and she found a blog post written by a woman. And she read this post and she said, you know, this woman sounds like you. It sounds like a similar condition. And she told me this woman read a book written by an American doctor and she became better. And I said, okay, nothing to lose, right? So we ordered the book on Amazon and the book arrived within a day or two. I was lying in bed, literally lying on my back like this, reading the book, okay? And as I was reading the book, I started feeling better. It was like a miracle. After 3 days, I went out of bed. That was amazing because with such intense pain, what would normally happen is that I would need to stay 2 or 3 weeks in bed without being able to function. Like normal daily activities would become almost impossible. So after 3 days, I went out of bed. My wife and my daughter were looking at me as if I was not okay. So they were looking at me and asking, are you sure? Are you sure you want to do it? Because they were used to me needing to stay in bed after such attacks for at least 2 to 3 weeks. So it was weird. And my friends were kind of, surprised. And my family were surprised. And then I kept on reading the book. And I want to show you the book immediately. I kept on reading the book and got better and better and better. That's the book. It's the book. It's a book written by Dr. John Sarno, an American doctor. It's called Healing Back Pain, small book. This book saved my life. All right? And after 3 weeks, I was already out, lifting heavy things. I lifted a suitcase. And then after 4 weeks, I went out for a short jog. And then I knew that the pain was over. I was pain-free. I was feeling okay again. I was resuming more and more activities. So after recovering, I wrote Dr. Sarno and thanked him for basically saving my life. And he replied in a very heartfelt, heartwarming way, which I was grateful for. And as you can see, I have my notes here, so I don't forget anything. I want to share everything with you. This is really life-saving advice. It saved my life, and it saved many other lives. So I want to share it completely with you. So after recovering, I wanted to prove myself that I can really do everything. And I participated in a really intense physical activity program. Did those crazy things, exercised outside in the cold in Berlin, and then I saw that I can do everything. I could do very intense exercises. I was okay, I was well, no pain whatsoever. There was no fear also from movement, from hurting myself, from re-injury that was left. And then I said, I have to share it with other people so that they know it, they know about it, and they can also heal through that. It's simple, it's straightforward, and it really saves lives. And then I said to myself, I promised myself that if I feel okay after 3 months, I have to share it. That's why I'm doing this video, of course. And now I want to share with you what the major things that really helped me recover from the pain were. The first thing was understanding that pain, real pain, physical pain, pain in the body could be very real, but without any structural damage. So there's pain that comes from structural damage, which is the minority of cases in chronic pain, and there's pain that comes from the brain, real pain, real physical pain that comes from the brain. It's harmless and it's reversible. Understanding that my very real pain, the same pain that woke me up from sleep crying, this immense pain could be generated by the brain, and it doesn't mean that something's wrong with my body. It just means that something's going on in the pain mechanism in the brain, which is reversible and harmless. Understanding that released the fear of the pain, which is a very important one, and released the fear of movement, of doing things. I wasn't afraid anymore that I could hurt myself if I would lift something up or jump or run or walk or, just go out and have fun and enjoy with friends. All right? So the three major things were releasing the fear of the pain and releasing the fear of movement and hurting myself. That was one. Second was resuming regular activity gradually, and with the confidence I managed to do more and more and more. And the third thing was understanding that real physical pain could be generated in many cases by the brain without a structural cause. That was very revealing, it was very freeing, and it set me free from the cycle of fear, pain, avoidance, more fear, more pain, more avoidance. So, after 3 months with this intense physical activity, I understood that I'm okay. It was cemented, the understanding that I'm healthy and pain-free was cemented. I wasn't afraid anymore of relapses, I wasn't afraid anymore of the pain, and I managed to do whatever I literally wanted. But then started a new phase. And this phase was a phase of realization that I have to share that with other people. As I mentioned, I saw so many people that suffer from chronic pain, neck pain, back pain, sciatica, fibromyalgia, migraine headaches, tension headaches, and the list goes on, that aren't aware of the simple, straightforward way to heal from their pain. And then I started writing about it, lecturing about it, making videos about it, and my aim and goal was and still is to share this knowledge. Of course, another thing that happened, that it transformed the way I practice medicine completely. I started shifting the entire focus in my practice to this direction, developed more and more strategies to help people understand how to heal from pain, what to do, what strategies to use, what techniques to use, so that they could, as I did, heal from their pain. And now I want to shift from the personal to the professional. So I started out this journey as a patient. I suffered from pain myself, but then it started influencing the way I practice medicine, the way I help other people heal from pain. So it started influencing my practice, and a whole method started developing around these concepts, and it evolved more and more, and I was able to manage to help more people recover from pain. So if you yourself, if you suffer from pain, if you're a therapist that suffers from pain, we know that some therapists, like I did, suffer also from chronic pain, or if you're a therapist that is interested in helping people recover better from pain, using more advanced and new knowledge and techniques to recover from pain, then I want to heartily invite you to watch the second part of this video, in which we will revert to the professional angle and see how we as professionals can help our clients and patients heal better from chronic pain. So if you want to go with me to the professional angle, I heartily invite you to watch the video that pops up on this screen right now. And I really thank you for being here. I really thank you for sharing this journey, sharing this knowledge, and wanting to help more people heal from the pain. If you like this video, of course, you can like the video, you can share it with other colleagues or friends or people that need this knowledge and can be benefited from it. And of course, you can subscribe to the channel as well. So I hope to see you also in the next video. Thank you for being here, and until next time, bye-bye.